looking for the entire county, serving Dillon, Latta, and Lakeview by covering our local news and upcoming events. Please join us now for Chamber Moments.
Hello, welcome to Chamber Moments. I'm Johnny Lors. Today I have as my guest Mr. Herbert Jacobs. And Mr. Jacobs has been a volunteer for the census, and we're getting down to the wire. So let's talk a little bit about census and what we need to do.
Simply stated, we need to get everybody in the county of Dillon who has not been accounted for by being included on one of those census surveys to be counted and included. Simply stated, again, every person in the county of Dillon that is counted, and we have a deadline of October 31st. Every person who is counted in the county of Dillon, the county of Dillon gets approximately $3,000 per person per year for the next 10 years. If we do not get everybody counted by the 31st of October, there will not be an opportunity for a do-over until the year 2030.
Now, I know that now there's some folks going out into the neighborhoods. They will have proper identification, is that correct?
That is correct. They will have the officially issued badge from the U.S. Census Bureau. They will have a little satchel or attache that they carry, maybe over their shoulders, with the U.S. Census Bureau information printed on it. They will also have a little iPhone that they will use in order to gather the information from each of the individuals or each of the households that they approach and assist in submitting the survey materials. So they're clearly identified.
Now, when you said the county receives $3,000 per person, how is that money used? The county doesn't get $3,000 because of like Johnny Lors or Herbert Jacobs, but I mean to use for your personal use. How is that money used? What is it used for?
That money is used to cover virtually everything that anyone can think of that the county provides funding for. We have schools, District 4, District 3. Those districts get a portion of that money. We have health care, indigent health care, for example, but established health care. You know, McLeod is the biggest facility here in our area. McLeod gets a portion of that $3,000. We're looking at streets. We're looking at infrastructure. We're looking at emergency management. We're in hurricane seasons. And not too long ago, in the recent memory of most of us, Hurricane Florence did her job. And there was one before Hurricane Florence. It did its job too. We had streets that were completely blocked because they were flooded. We had bridges that you couldn't navigate because either they had been washed out or the fear was they were not stable enough for vehicles to go across them. So folks had to get alternative routes to go to wherever they wanted to go. And it's my understanding that during the height of Hurricane Florence, there were problems with some of the rescue personnel getting to individuals who had not vacated their homes when they were advised to.
Now, if someone has not received anything because it has to go to a street address, not to a P.O. box, what do they need to do to make sure that they're counted?
There are several things that they can do on their own. If they did not receive the printed form, which typically comes with the questionnaire and a self-addressed postage-paid envelope that one can put that questionnaire in once one fills it and just drop it in the mail, postage paid, as I said. If that does not occur, then one can dial a 1-800 number. And most of us have cell phones if we don't have house phones, or we have access to some form of phones. And the number that they would dial in order to give the information that they would put on that paper form, that number is 1-844-330-2020. Again, 1-844-330-2020. 2020 or 2020.
Okay.
That's a method. Another is they can simply go online. You know, many of the folks with their mobile devices, cell phones, they have access to the internet. If not, you have a computer at home, or you have access to someone's computer that you can utilize. Fortunately, the library is not open now, therefore, folks who ordinarily would have used it don't have access to that. But otherwise, you can do it online. And the website for that is www.my2020census.gov.
And once again, we only have until when?
The 31st of October this year. And if it's not done by the 31st of October this year, there will not be a do-over on the 1st of November,
Okay.
nor anytime else until 2030 census comes around. And we miss out on all that money. And I may add, if I might,
Yes,
real
please.
quickly. As a result of the pandemic and the impact on economic movements and so forth, on the 1st of September this year, the Dillon County Council met, had the third reading of the new budget. And anyone who owns property in the county of Dillon will experience a tax increase. This was done in part by the county because they had a shortfall of revenue. It's my understanding in speaking with the chairperson of the Dillon County Council that they did make some cutbacks in the various departments within the county of Dillon. But that wasn't enough.
So we need to do everything we can help our counties, and we need to complete our census forms, and that will help our county, and that will help us in the long run with our education, our roads and our bridges and infrastructure and our hospital and education. That's the most important thing. Once again, October the 31st is the last day. We cannot wait to November the 1st, and we are encouraging everyone to get out and make sure that they complete their census form. It's simple, easy, just a few questions, and it's not invasive at all.
Not invasive at all. Probably the most personal information you will share will be your age, your date of birth, and let's say for the primary person in the household, that person may be asked if they would share their telephone number such that the Census Bureau would have that to make contact with them should there be a problem with some of the materials that were submitted in the survey. And I'll go on and say this other last thing. There is a big push now through the end of October. I spoke with members of the field supervisory team, that is the supervisors that manage those individuals who are now going door to door, trying to get folks to participate. There has been an influx of additional people who will be coming to the doors, knocking on the doors. As of Saturday, this past Saturday, there was an additional group of people that have been brought to the county with the sole purpose of making contacts with those homes who have not responded yet. So I would simply ask, please do it online if you can. Do the 1-800 telephone call. If you have the paper form, just go on and fill it out. There will be people coming by. There may be people who will send you emails. And when I say people, I'm talking about the U.S. Census Bureau people. They will send you emails. They will send you texts. They will make telephone calls to you, home phone as well as cell phone, because they are trying to get those numbers up. And in 2010, the county of Dillon counted roughly 7 out of 10 people. That means that 3 people were not counted in the county of Dillon. Because of that, Dillon County lost roughly $2.8 million every year over the past 10 years, starting in 2011 all the way up now to 2020. If you add up that $2.8 million that were lost, that amounts to about $28 million that the county of Dillon did not get because only 7 out of 10 people were accounted for. And here's the real caveat. For those 3 people who were not accounted for that $28 million that the county did not get, I can assure you Marlboro got a portion of it because they had a better count. Marion County got a portion of it because they got a better count. Florence County got a portion of it. Horry County got a portion of it. In short, if we don't get our numbers up and we miss out on monies that we could receive, those monies that we could receive go to those counties that did a better count.
Okay, our main thing is have our folks fill out the census forms by October the 31st,
Yes,
2020.
and be cooperative with those people that come by knocking.
Exactly, exactly. Thank you, Mr. Jacobs.
You're welcome.
I'm Johnny Lures with Chamber Moments. Hello, welcome to Chamber Moments. I'm Johnny Lures. Today I have as my guest Don Strickland, and Don is with PDRTA. Welcome, and first let's tell our viewers what PDRTA is.
PDRTA is the regional transportation provider for the PD region. We cover Florence, Darlington, Dillon, Marion, Marlboro, and Chesterfield counties. And it's public transportation, so you know, it's getting folks to where they need to get to, whether it's work or shopping, medical, you know, whatever they need, we're there for them.
Okay. What kind of transportation is it? I've seen some buses around. I've seen some Mountain Dew buses and some all kind of different buses and stuff like that. Are they your buses?
Yes, ma'am. So proud to announce in Dillon County, we now have the, it's called the DCAT, Dillon County Area Transportation. And it's actually made up of several different things. We have a route that runs around the city of Dillon. It covers a pretty big area around Dillon County. So we have the fixed route around the city of Dillon. We have connecting service to Latta, Lakeview, Little Rock, Hamer. So basically anywhere in Dillon County, you're able to get to and from throughout the services.
Okay. Now, how would I be able to ride the vehicle, the transportation? How could I use that?
Okay, so we have bus stops, temporary bus stops now. Eventually we'll have permanent bus stops. The one good thing about what we have going on here in Dillon is that the service is fare free. So there's no cost for anyone to use the service. They're able to get from point A to point B. You know, you don't have to rely on your family or neighbor or friends. You know, sometimes those are good things, but sometimes they're not available. With the demand response service that we have, you can call us a day ahead of time. You know, if you need to go to a medical appointment tomorrow, you call us today and we'll be able to schedule that and get you there. Okay.
What are your hours that you operate?
The main bus in Dillon right now is running roughly 8 to 5. We have connecting service between Latta, Little Rock, and Hamer on Mondays, Wednesdays, and Fridays. We're running demand response to Lakeview on Tuesdays and Thursdays. But with all that being said, the demand response service pretty much any time between 8 and 5, Monday through Friday right now.
Now, is it just to like a doctor's appointment or to the hospital or to the drugstore? What if I needed to do some shopping or if I need to do some banking? Is that part of it, or do I have certain stops that I can get off and walk a few feet? Or
Yes, ma'am. So absolutely. So when designing the routes, we try to hit, you know, the majority of the places that folks really need to get to. So your banks, the hospitals, Walmart is one of the big stop, of course, in Dillon County here. But yeah, so pretty much anywhere that you need to get to, you can schedule your ride for the demand response side, or you can actually take the fixed route bus that's running around the city.
Mm-hmm. Are there certain locations that I have to be at?
It's a flag stop system, so anywhere along the route, you're able to kind of just put your hand up and wave at the bus driver. They're constantly looking for passengers, so you wave your hand, they'll stop and pick you up. Eventually, once we do a little more work and gather data, we will be coming into Dillon and putting in bus shelters. So an area where you can actually get out of the weather if it's raining, but also there'll be permanent bus stops throughout the city.
Okay. Is there an age limit or a requirement?
It's pretty much open to anybody in general public. So, you know, we don't want real small children riding by themselves, so those should be accompanied by a parent. But, you know, it's a fare-free service, so we have folks anywhere from, you know, infants to, you know, up on age and their age to get, you know, to and from wherever they want to go.
How are they funded?
At PDRTA, we're federally, state, and locally funded. Roughly 67% of what we do is covered by the federal government. We've been blessed to have many stakeholders in Dillon County, from the county itself, McLeod Hospital, Care South, Care First Foundation, the Dillon County Long-Term Recovery Group is a part of that, Anderson Brothers Bank. There's many. Harbor Freight is a big one for us in Dillon, and we're actually going to be extending service to them very soon, and we have some plans eventually to do more there. But yeah, so it's roughly 67% federal. We have to have the local stakeholders come to the table, and then we also have state funds. Without the local stakeholders, we're not able to touch any federal funds. So you're leaving money on the table. In the past, PDRTA has left funds on the table because they didn't have enough local stakeholders. But it seems that in Dillon, the awareness is there, the need is there, and the folks that have come to the table to become partners and stakeholders, they see it, they know what the potential is. So it's been good.
When you're talking about the local stakeholders and the partners and everything, with some of our industries, they work several different shifts. And do you anticipate you extending your hours to cover some of that to help?
Yes, ma'am, absolutely. So just for instance, Harbor Freight situation, most of your general public, they want service from 8 to 5. Harbor Freight, they may need to be at work at 6 a.m. or 7 a.m. Other entities like maybe Purdue and some others. But yeah, so we will provide service beyond the normal 8 to 5 to be able to get employees to work. We want to be able to assist those folks to make sure that they're able to earn an income and get home and provide for their families.
Okay. Do you do any weekend, or do you anticipate that maybe happening in the future? And with the holiday season coming up, and with COVID, what are the precautions? Are the hours going to increase or anything on that?
Yeah, so currently we're, I'll speak to the COVID first, I guess. We're doing a lot on our end to help try to socially distance. We provide every passenger with a face mask. We have a disinfectant protocol where there's a product that's sprayed. It's a food grade material, but it basically can be sprayed and passengers can be on soon after. There's no long waiting period, and it does treat the virus itself as far as disinfecting. Our drivers, they have disinfectant sprays. The high touch areas are constantly, if they run a route, they get back to their starting point. If they have 5 minutes, they're actually going and wiping down those areas, just to help, try to limit the spread as much as possible. But the biggest thing is that we still encourage people to wear masks as they use the transit system, and to spread out. We started Dillon County, the Dillon Transit, with a larger bus. It's actually a 31 passenger bus, and we did that so that folks could spread out some. The ridership is continually growing. We're in the second month now. September, we had pretty much a partial month in August, but the numbers are increasing daily. And as far as expansion, there's a lot in the works. We're looking, along with Harbor Freight and some other entities, we'll end up connecting Dillon County to Florence County. We'll connect Dillon to Marion County, as well as Marlboro County. The one thing that we've learned, especially as employees, there's a lot of employees coming in from outside of Dillon County to work in Dillon, but it also works the opposite. There's a lot of folks that maybe work in Florence and Marlboro and Marion counties, and we're going to give those folks options to be able to get to and from. I was in a meeting earlier today where a lady needed to get her husband to McLeod and Florence for some treatments, and we'll be very excited whenever we get to the point where we can actually tell her, all you do is call us, and we'll have that. And that's coming very soon, hopefully as early as 2021, January maybe.
Awesome. What do we need to do as viewers? How can we support you? What do you need from us?
The biggest thing, excuse me, for the most part, is that the viewers understand that we're doing everything we can right now during the COVID situation, but also our drivers, they have first aid, CPR trained. Each bus that we operate, it has 6 to 8 surveillance cameras. That's audio and video. So it keeps I've been there at the agency now 12 years, and we really haven't had anything serious take place. And I think the cameras and the driver training has a lot to do with that. So it's a safe, clean environment. Wintertime when it's 15 degrees outside, and it's always warm on the bus. And the summertime here in South Carolina, if it's 105, it's going to be cool on the bus.
So you can just ride. If you just want to do the scenic tour.
We do have some of that. We do. But I guess the biggest thing that I would ask the viewers to do is to help spread the word. You know, the best thing that can happen in our situation is that ridership continues to grow like it's doing. We call it the butts in the seat model, and the more we have in the seat, the more federal funding we have, and it allows us to do more on the local level. So helping to spread the word, and you know, some folks are fearful. Anything different sometimes is scary, but I encourage folks to step on the bus. You know, whether it's a local politician, anybody in government, I think some of the best things they can do is actually step on the bus, have the conversations with the people that need this service. It was an eye-opener for me when I started the transit business. I started 12 years ago. I lived in Florence 28 years, knew nothing about the PDRTA and what we did, and I spent my first 2 weeks on the job just riding and meeting people. And for me, that's when I was hooked. I saw what it did for people, how it helped individuals get to medical appointments, get to work, and everything else. So I knew then that I was probably going to be there for a little while.
Well, thank you, Don. I want you to come back again in January and just update us and let us know again what we can do to help you.
That sounds great. Thank you so much.
I'm Johnny Lewis with Chamber Moments. Hello, welcome to Chamber Moments. I'm Johnny Lewis. Today I have as my guest Don Lewis, a local meteorologist. Hello, Don. How are you today?
I'm doing good. How about yourself?
Doing well. We've completed the alphabet.
Yeah, in the tropics we ran right through the entire alphabet, all 21 names. We skipped a few letters, so there's only 21. And now we're working our way through the Greek alphabet and doing a pretty good job at that too.
Okay.
So it's been a really an impressive year for named storms. Right now we're sitting at 25. A normal season has 12, so we've doubled it, and now we're working on more than double.
Okay. We have been very fortunate not to have direct hits.
We have not had any huge impacts here in the Carolinas from the tropics, which is a blessing because we've had more than our share in recent years, especially with Matthew and Florence going back just a few. So we needed a year off, especially for the farmers especially, because they needed a good year. Hopefully they're getting that. But outside of us, it's been, as you can tell by the names we've gone through, a very, very busy season.
Even though that we have not been directly hit, we still do not need to let our guard down. Is that true?
That's true. Historically, right through the month of October, we have to keep an eye out because there have been October storms in the Carolinas. Probably the most famous one is Hurricane Hazel in 1954. That was a mid-October storm. So just because we flipped from September to October doesn't necessarily mean we're completely out of the woods. So it'd be worthwhile keeping your guard up for a while longer.
When does this season officially end?
Officially ends November 30th. Now there have been storms outside of official season, both on the early side and the late side. There's not a zero chance we'd get something after November, especially given how the year has been. But
2020.
but that is the situation. There's been some really impressive storms. Delta, Hurricane Delta, fourth storm of the Greek alphabet, it went from a tropical depression to a Category 4 hurricane in 30 hours. That's a record-setting intensification for depression to Category 4 that quickly. So the season's been full of standouts as far as record books. Unfortunately, Delta's going to have big impacts on the U.S. Probably Louisiana looks to be most under the gun.
Will we have any effect from that?
We could get some residual rain from it, but we won't have any direct damaging impacts from it.
Okay. So what do we need to do to be on guard and make sure that we've got everything safe and taken care of?
Well, as always during hurricane season, you want to be ready with what they call your hurricane kit or hurricane supplies. That's a little bit of food that doesn't need to be prepared with any sort of power. You need to have some sort of backup power plan because you might be without power for a few days if a storm did come. And that's something you really want to do year-round because once we get through hurricane season, we'll be going the other way, and sometimes our longest power outages have been ice storms. So it's always a good idea to be aware of what you would do if the power did go out for a few days. But other things in that kit would be what would you do to have your medicine, what would you do to have mentioned food, also water, and of course, what would you do with your pets if you did have to evacuate?
Okay. Are you still available to speak to organizations and groups and churches and all?
Absolutely. I enjoy speaking on either hospice or weather, so if anybody would like me to come and talk to their group, just give me a holler and I'll come.
Okay, thank you, Don.
You're welcome.
I'm Johnny Lewis with Chamber Moments.